So let's talk now specifically about the metatibia nail. We finally got that biomechanics study completed, and it was actually published in the JOT in 2011 by Freeman and others. What we showed was that metatibia nails have greater proximal stability than both the Stryker T2 and Synthes Expert nails. These three different nails are shown in these images. Here it is, plain and simple. Our screw configuration is superior to your competition. Another recent study published in Orthopedics 2011 by Wagner and others showed a 15 to 45% increase in fatigue strength when comparing the Trigen metatibia nail to the T2, Expert, and MDN tibia nails. All modern nails are not the same. Another subtle point, our threaded distal hole eliminates the need for an AP screw. In typical nails, the crossing pattern of locking holes is necessary for stability. We all know that. We just showed that with our proximal study. The problem, however, is that the AP screw in a distal tibia nail can be troublesome. It requires an additional setup for targeting and can be very irritating to the patient due to the thin, soft tissue covering over the screw. Our distal threaded hole in the ML plane restricts the medial-lateral translation of the distal fragment, which is typically the job of the AP screw when there is a very distal fracture. I'll tell you something else about that distal hole. It's the most distal you can find on the market. A lot of times this is debated. There are competitive nails in the market that are slightly more distal, but they are slightly more distal by 0.5 millimeter. Guys, that is the tolerance we have on the position of the hole itself. I'll put it another way. The wall thickness of our nail from the edge of the distal hole to the distal end of the nail is only 2.5 millimeters. In these other nails, that thickness is 2 millimeters. This is a negligible difference. There is no one that has a truly more distal hole in their nail than us. It is simply not possible. Let's move to the instrumentation, because again, here we have unique differences that make us superior and stand out. With the metatibia nail, we can actually compress the fracture before or after guide removal. No one system can do that. Because our compression slot is in the most proximal hole of the nail, we can actually use the compression driver through the cannulation of the guide and compress the nail with the guide attached. Then, while leaving the compression driver and guide attached, we can add additional static proximal fixation, which rigidly locks in the compression. We also have the option of going ahead and removing the guide, and then using our compression set screw to compress the tibia. We were the first to market semi-extended instruments. Again, others have now followed with their versions of semi-extended instruments, but we truly feel what we have is the best technique for this procedure. We feel like we have a unique technique that is imperative for our surgeons to follow to achieve the most repeatable and effective results. Where others have designed their instruments to allow the nail to pass through the entry tube, we have designed our guide and nail to be able to pass through the joint without the need for the entry tube. Our entry tube is only large enough to allow the instrumentation to pass through it, which keeps its size very small and easy to insert into even the smallest joints. To achieve the requirement of inserting the nail through an entry tube would require a significant increase in its diameter and/or a conical shape. This creates several issues. It makes it much harder to insert the tube into the joint and requires more distraction and dissection. Conical tubes have a problem in that they want to slide out of the joint, thus putting the cartilage at risk when they are pushed back in. It's really important that you understand the key differences between our system and the competition. It's not a shortcoming of our semi-extended instrument to not allow the nail to pass through the tube. It's an intentional requirement not to insert the nail through an entry tube to protect patients and make this procedure easier for our surgeons.